Hi there, my name's Dr. Sonal, and these are my opinions only, not of the institution I work for, not related to the medical community of which I'm a part of, but just my opinions. Thank you. Hi there, I'm going to show you how we're making masks in our own home for when we go outside for our walks and to the grocery store. We're going to take a bandana and fold it into thirds. I got this from Jamie's mom on Facebook. And after you have folded it into thirds, then what you'll do is you'll use rubber bands. I have hair ties, but you can just use office supply rubber bands, and you'll bring them in just under a third from each side. The Surgeon General also has a video on how to do this with a t-shirt, which I have seen and is also a very good option. Just because you'll have multiple layers, this one will have 9 layers of bandana by the time you're finished. And so you're going to fold it over and tuck in the other end in thirds roughly. And so by the time you're done, you have had multiple layers here. And if you're going to end up cutting up something anyway, you could choose a finer fabric that has a higher thread count if it's in your trash pile anyway, just so that there's a little bit more protection. But really this is to keep germs from going out of your mouth. And if everyone wears something to keep germs from going out of their mouth, then we shouldn't have to worry about germs going in our mouth. After you have your bandana mask on, before I leave the home, I can adjust it, I can cinch it, I can fix it how I need to make sure it feels secure. But after I leave the home, I can only touch it here by the rubber bands. And when you take off this, you want to take it off from your ear bands and make sure that you hang on to your rubber bands while you allow the handkerchief or bandana to fall straight into the washing machine. These can either be washed with it if you have like a lingerie bag or something that if they're the washable kind. If they're the office supply kind, then I would leave them on the side and reuse them every 3 days so that if anything's on them, that you give them a chance to become clean again as well. So you would just cycle through different sets of rubber bands. But the big thing is that you have to treat the outside of the mask like it is dirty. And you have to treat, in this case, a cloth mask like it's dirty after you leave your home. So it's a one-time use. The outside is dirty. You're trying not to touch the inside if it's something you have to reuse. And you want to wash your hands, touch your mask to take it off, put it in the washing machine directly, and then wash your hands again. And that's just because that's your biggest risk of exposure to is on the outside, and you don't want to be having your dirty hands touch your face after that. And the other option is if you have a different kind of mask, like a surgical tie mask, with their homemade or store-bought, then what you want to do is take the bottom ties and untie those first. By doing that, then you allow the mask to fall away from your face and not towards your clothing. And then you'll do the top ties and remove those, and you'll pull it away from your face again and away from your clothing. And if it's a reusable kind, dump it straight into the washing machine. If it's not the reusable kind, dump it straight into the trash. The reason with the surgical tie-back mask you don't want to undo the top part first, which is the rookie mistake a lot of people do, is if you undo this and it's like, psh, guess what? I just put all the germs on my shirt, and that's no good. And then if you put all the germs on your shirt and then you're taking off your shirt, guess what? I just inhaled all the germs. And so you want to make sure that you don't do that. So again, with the surgical tie-back mask, undo the tie in the bottom first. The mask will be dangling away from your face, and then you can remove the top tie and pull the whole contraption away from your face.